All right, joining us right now is Danielle Ompad, who's a professor of epidemiology at NYU School of Public Health. Thanks for being here. First, I want to get your thoughts on that whole thing that the president has been saying and was saying again yesterday, that hundreds of millions of doses of COVID-19 vaccine could be available at the end of the year. The facts are what?
So it is in the realm of possibility, but highly doubtful. The process for developing and testing a vaccine actually takes, like Dr. Fauci says, between 12 and 18 months if we're lucky. That's if we have a vaccine that is a good candidate vaccine and shows evidence that it is efficacious in early trials. So we're not there yet, and it's unclear how long this is going to take.
You know, we talk about people going outside. Of course, places are reopening, but even in places where these shelter-at-home orders still exist, people might be getting a little stir-crazy. And that's being reflected in a new poll. There's a new Gallup poll that shows 58% of Americans said they're either completely or mostly isolating themselves. But that's down from a high of 75% who said they were at the end of March, 68% who said they were in April. So this includes states that haven't lifted lockdowns. Does that number concern you?
It does a little bit. I mean, what we have to remember is that even though the entire United States is in the midst of a pandemic, each community's epidemic curve looks a little bit different. And so it does make sense in some communities to have more freedom to be out and about and not necessarily self-isolating at the same levels as other places where we have a lot of cases. On the other hand, it's still really important, if things open up, to maintain social distancing and to continue to wear masks.
I don't know if you saw, but this week, one of our contributors, Dr. Joseph Fair, contracted coronavirus. He ended up in the hospital, said he couldn't breathe. He believes he got it through his eyes, and he said we tend to pay attention to the nose and the mouth, but droplets landing on our eyes are just as infectious. This is somebody who knows exactly what to do, takes every precaution. Is the goggle, the eye protection, the new mask?
You know, I am not sure if that's where we need to be right now, but it definitely wouldn't hurt if that's something that people are concerned about. I mean, again, I think it's important to maintain social distancing. So the farther you are away from each other, the less likely you are to either contract the virus or spread the virus, even if we're talking about droplets that land on your eyes.
Well, we do have to remember, just 2 months ago, we were talking right here around this time, and they were saying that the mask didn't make a difference at all and weren't recommending going out to get masks. So in 2 months, who knows what sort of gear we'll be in. There is a new study in the meantime that shows that talking can launch thousands of droplets so small they can remain suspended in the air for 8 to 14 minutes. What does this tell you about how the virus transmits from person to person?
So this is why we social distance. We knew that it was going to be distributed via cough or sneezing. However, we know that people expire droplets when they're speaking. And so even if you are not showing symptoms, it's obviously going to be possible to transmit. And so the combination of masking and social distancing is going to substantially reduce the risk that you either acquire the infection or transmit the infection to somebody else.
And Danielle, really quickly, because I was thinking about this yesterday as I went out for a run. It wasn't a very good run. It was a hot day, but that's my excuse. A whole nother matter. But there I was running past people who didn't have masks, and I was wondering about the sort of droplets that they were putting out there and that I might have been receiving. Are you getting more or giving more at that point?
It's possible. Think about the force with which you're breathing and expiring air. Well, at least when I run, there's a lot of panting and red face. And so I can imagine that the force with which you're expelling air is going to increase the likelihood that you're going to be spreading droplets. So we really should be masking when we're running and maintaining social distancing.
All right.
There's a lot of panting going on over here. You're not
alone. Exactly. We're going to blame the mask. Danielle, I'm sure your running skills are much better than mine. Thank you.